Welcome to the Deep Dive. We cut through the noise, get straight to the core of new research. Today, we're looking at something pretty critical. The health of kids conceived using assisted reproductive technology, RT. We've got this new study from Frontiers in Endocrinology, and we're going to unpack what it says about different ways embryos are transferred.
Absolutely. It's a field that's, moving incredibly fast. RT has helped so many families. But these questions about the kids' long-term health, they linger, don't they? What's really interesting here, I think, is how this study gives us maybe surprising clarity. Does fresh versus frozen transfer really change things for the child's early health? It kind of sharpens the picture.
Okay, let's get into it. It's a big study from Taiwan, right?
Mm-hmm.
Retrospective cohort, over 10,000 ART singleton births compared to, almost 900,000 conceived naturally. So, the big question, how do these different transfer strategies, fresh, frozen, cleavage stage versus blastocyst, how do they stack up for neonatal and early childhood health?
Right. And the first thing you see, the headline finding, if you will, is that yes, our key kids did have higher rates of some conditions compared to the naturally conceived group. We're talking things like preterm birth, ADHD, developmental delay. So that confirms some existing worries.
Okay, so higher risk overall for ART. That's clear. But here's where it gets really interesting. You mentioned the clarity. They then compared the different types of ART, didn't they? So despite those overall increased risks, what happened when they compared, say, fresh versus frozen directly, or the different embryo stages?
Exactly, and this is, it's quite the finding. When comparing those specific strategies, fresh cleavage, fresh blastocyst, frozen cleavage, frozen blastocyst, they found no significant differences in major disease incidences. None.
No significant difference for major conditions. That's
Exactly.
Unexpected.
Yeah.
So the specific way the transfer is done, it doesn't seem to be the main driver for those big health outcomes.
That's what this data strongly suggests, yes. The specific technique doesn't seem to shift the dial much for major neonatal or early childhood diseases. Now, that doesn't mean there were no differences. There were nuances. For example, they did find that frozen embryo transfers were linked to higher odds of having large for gestational age babies, LGA. Bigger babies, basically.
Okay, so LGA with frozen transfers. Interesting. What about, you mentioned ADHD earlier being higher overall. Did one specific key method stand out for that?
It did, quite dramatically, actually. The hazard ratio for ADHD was much higher in RT kids overall, but especially high in the fresh blastocyst group. We're talking a hazard ratio near 20. 20 times the risk compared to natural conception in that specific group. That's substantial. And developmental delay risk was also higher with fresh blastocyst transfers compared to fresh cleavage stage. Just to remind everyone, cleavage is earlier development, blastocyst is later.
Wow, nearly 20 times for ADHD in that group.
Okay.
Any other patterns like that for the more nuanced conditions?
Yes. They noted frozen blastocyst transfers had a higher incidence of things like atopic dermatitis and croup compared to frozen cleavage stage. But interestingly, on the flip side, frozen transfers overall, both stages, seemed linked to a lower rate of respiratory diseases. A bit of a mix there.
So some specific links, but no major differences in overall big diseases between RT methods.
Exactly. And this leads to the study's sort of main conclusion, connecting the dots. They suggest these elevated risks seen in RT might actually be more about the underlying parental infertility itself rather than the RT procedures per se.
So it's potentially the why RT was needed in the first place, not just the how it was done.
Precisely. It's like the starting point matters more than the specific ART path taken, at least for these major outcomes.
Okay, so let's boil this down for you, the listener. What's the practical takeaway? This deep dive shows that, yes, RT conception comes with some increased risks preterm birth, ADHD are noted here, but crucially, the choice between frozen or fresh, or using a cleavage versus blastocyst stage embryo, doesn't seem to dramatically change those major health risks for the child early on.
Right. It really underscores that we need to keep optimizing the whole RT process, the perinatal care around it. But it also forces us to acknowledge how significant that background parental infertility might be for the child's health. That's huge for counseling patients, giving them the full picture.
Okay, and here's a final thought to leave you with. If that underlying parental infertility is such a powerful factor, what does that mean for future research? Should we be focusing more effort on understanding and mitigating the health impacts of infertility itself, no matter how someone ends up conceiving? What new support could emerge from that angle? Something to think about.